So in this presentation that I'm sharing with you, um, I think it's just to frame this whole hour. We want to kind of talk about collaboration in action, and a big part of what we do in our work is underpinned by compassion. And for me, compassion is listening. It's got to always start with attending, listening with fascination to as many voices and people as possible. It includes reading and learning and looking at the evidence, which also captures diverse voices, looking at the reports and the reviews, but trying to then move into understanding beyond our own perspectives, and then being able to empathize the best we can. And I think through that empathy, it drives us to the fourth and important part of compassion, which is helping and acting. And I think that's something we've all been driven to do, is to be part of the action to make a difference together. So, like you, Laura Rose, and your team, many of us that have been working collaboratively in different ways, we felt that it was really important to come together and share ideas and perspectives and be supportive. And a group of us have come together, including obstetricians, midwives, researchers, leaders, organisations, and clinicians and families have come together as a maternity and midwifery birth collective, just again to focus on some of the acute issues that were arising that we wanted to be able to collaborate on and discuss in a meaningful way. And I know there are many other organisations that are coming together as well, like all of the professional associations have come together in a partnership, which is also really fantastic to see, those collaborations all occurring. And like you said before, Laura Rose, it's really great that we can come together as well as collaboratives with many voices coming together and always open to coming and sharing and discussing things which we're hoping to share together tonight. Because we are facing challenging contexts, and we're seeing emerging articles coming out about maternity crisis alongside all of the reviews and the underpinning justifications for this rapid review to bring together all those lessons, and hopefully thinking about how we can really redesign and reconsider how we approach maternity and perinatal care moving forwards, including everybody that's obviously primarily the people being using those services, and having them at the heart of everything that's done that happens, but then also the people providing care in those services. And I think that's so critical that we come together to address the challenges together, recognizing them, but also understanding we can move forwards together to brighter days. Because sometimes I think when we're facing challenges, we can feel like we're at the edge of a precipice, and it can feel really quite scary. And I think taking a moment to notice that all of this concern that we feel out of our deep commitment and care for making a difference, and for all the families that are having to continuously fight for their own rights, the rights of their families. It has a massive impact on our nervous system, and we know the impact of that. So I just think sometimes we can all feel this in our work, and taking a moment to recognise that and care for each other is what we need to do in order to feel well, so that we can sustain the work that's needed to build a better future. But sometimes when I'm feeling like that, I take a moment to sit back. I suppose sitting back with you tonight, Laura Rose, feels like this for me, that I can kind of look up together. And then for me, just sometimes it's really important that we all have really different points of view. And for me, they seem like the different mountains in the distance, that we're all on our own journey. We're all on our own journey up different mountains with different challenges and different priorities. And that's so brilliant. But if we can take a minute from the top of our own mountains, even if we're not where we want to be, I think sometimes when we look out in the distance, we recognize, I'm part of a much bigger landscape here, and we're all part of it. And there's just something really important about recognizing that I really want to learn about the other journeys and the other mountains and the other landscapes that are around me. And I really want to get to know more points of view and perspectives. But there's something important about still recognizing wherever we are in our own journeys that we're all part of the same community and we're all part of the same picture. And so I just wanted to put this slide on because I think it always helps me to have a different view and to just take a moment to look after our nervous systems because after a big journey up a mountain, we can feel exhausted as well. And it's nice to be, I always do it when I walk up our local Pendle Hill near to me here. I'll always take a minute to just have a pause and I'm like, oh, I must look at the view, but really it's just have a rest whilst you're going up the hill. But we do want to know the way. And I think some of what we're going to learn from all of the reviews and the work that we're doing is we're going to work our way to knowing the way to move forward. But I always feel that it's always safer to do that together because it's where connection and community and where we can share vulnerability and be inclusive and where compassion is able to flourish, where we can really start to understand each other and to create a sense of collaborative approaches in our work moving forwards. And we know it's really worth doing that, like listening and learning. It creates a more civil community where we can really learn to approach each other with generosity and openness and bravery. I actually think really healthy teams are able to hold diversity and complexity together. And we do want to avoid incivility. We know that actually civility and moving towards civil workplaces and spaces actually saves lives. We know it makes such a difference, and we know what a difficult impact it can have when we don't create civil spaces for us to learn together. And we know just looking at the Civility Save Lives website, it's a great resource to give you insights into the importance of this in our work. We know that even if you witness incivil behaviour, it has a knock-on effect for you, the people you work with, and when we're in maternity and perinatal care or any healthcare or any service, it's going to actually have a consequence on the people we're aiming to serve. And we know that from the reports that we're hearing time and again that workplace cultures, have an impact, both positive and challenging cultures can have an impact. So what we're aiming to do through fostering collaborations is learn how we can also influence positive cultures across maternity and perinatal care, which we feel so critical. And you can see that it's been well mapped out as well across some of the leadership literature in the NHS and some of the reviews that have taken place. And we do know that really strong and positive leadership also can help make a difference to how we can foster these relationships in workplaces as well. But I think it all comes down to something that I think's really what I've been in awe in with your work, Laura Rose, has been the way that you create a sense of belonging through your leadership style and welcoming such a wide range of organisations to come and collaborate with you. And it's that sense of belonging that you're holding is something really important. And I think the feature of belonging for me is that you can come as yourself and be yourself. And we only can really feel like we belong if we really can be as close to ourselves. I know we can't always be 100% ourselves. We're just human beings. But if you're in a space where you feel you belong, often you feel you are being yourself. And I think that's what we would want in every culture and community, in every workplace. And I think that's something that we want certainly for families to feel when they use maternity and perinatal care, that when they come along, as soon as you walk through the door, you belong. And I think it's important that professionals and people providing care, that's our priority, is to how do we help everybody belong here, see themselves and feel that they can be themselves. And something I'm always looking for ways that we can really be conscious about this in the work that you do and the behaviours you foster. And this book, I think, is absolutely brilliant at helping to unpack it. Like, how do we do this in our workplaces, but in our organisations or in the work that we do? And I would invite people that are watching to go and read Inclusion on Purpose, an intersectional approach to creating a culture of belonging at work. And I think if we can do this with each other and with our collaborations, I think it'll make it so much easier to foster it for families in our services. And some of the 6 things that you're invited to consider when you're trying to implement this bridge framework, these 6 principles of the bridge framework are just captured there in green. It begins by us recognizing we need to be uncomfortable. I said at the beginning that that also, though, can lead to us having our vagus nerve and our nervous system triggered quite a lot. And so we have to also recognize that we need to look for support and care for each other, because when we're at this space where we're wanting to drive change and make difference, it can also be really burdensome and challenging, rightly so, rightly so. So we want to reflect on what we don't know, and we can only find that out by listening to other people. We want to invite feedback, avoid being defensive, which is so natural to get that defensive feeling, but can we work through it together and listen and learn, growing from our mistakes, but allowing for mistakes to happen and recognizing that's really a normal part, the human factors and ergonomic, that's a part of life. So let's sit together with it and help each other to move forwards and grow and expect that change takes time. So I thought this was a good framework for us to think about inclusive belonging. And there's a lot we've got to do because, as you said at the beginning, Laura Rose, there's an ongoing injustice and there's ongoing discrimination and marginalisation. And, in particular, systemic racism that needs huge pieces of work to address within maternity and perinatal care and wider health, social care, and of course our society. And we are living in a time of real political strain and conflict across our wider society as well, that all has impacts on how we provide maternity care. And I think as health providers and healthcare supporters, we can really be in a strong place to address some of these challenges together. And I really love this framework of how guiding people on the call that are doing work themselves, because it's a lifelong project, personally and professionally, that this is a really useful tool to think about that using the growth model, how we can grow and we encourage our children and our families to support them in their learning to push themselves outside their comfort zones. And I think it's a really good tool for thinking about how we can become anti-racist in our practice. And you could apply this to any area of discrimination, minoritization or marginalization. So thinking about how we can move from the fear zone where we deny there's an issue through into the learning zone where we might seek out learning and answers to the questions that we might have, moving through to the growth zone and identifying all of the ways that we might have had concerns and issues and how we can move forward and pass those to a more safe approach to our work and care. So I think it's just a nice way of looking at and thinking it through personally and professionally. But I always want to remind us that we do this in a calling in culture where we invite each other into the conversation as best we can without damaging our own boundaries and making sure we care for ourselves. But it's really useful to think about how we can call each other into conversations for learning and growth. So creating belonging involves this sort of working together and learning and listening, and being quite connected, which is the essence of this work. And that's what really underpins the Midwifery and Maternity Birth Collective, that's really just here to be as open and inclusive as it can feel and be. It was just a range of colleagues and people from across the country that wanted to come together and talk about what could be done to make a difference and be supportive of the next steps and contribute. I think it mirrors what you were feeling as well, Laura Rose, with your work and the things you were doing. So it's just this multidisciplinary group of midwives, obstetricians, families, academics, maternity care workers, advocates, and supporters. And just this united commitment to addressing these urgent challenges facing midwifery, maternity, and perinatal care in the UK, but also always recognising that that impacts on beyond us in the UK as well. So the way that we thought we could meaningfully do something straight away was to help bring and share meaningful resources that are supportive. So, updates from the maternity review, sharing recent articles, opportunities to join webinars, or, for example, sharing a bit of news from the collaborative work you're doing, Laura Rose. Anyone that wants to share things that they're doing locally or nationally, we can share it. So people can join. If you're watching this from your desktop, you can join by scanning the QR code on your phone to join a newsletter where you can just be shared information and updates, and that can feel supportive because it can also be challenging to stay up to date and informed. So the goal is that we're helping people to listen, learn, and act and be part of that inclusively. We've actually got over 400 people that have joined the mailing list to stay up to date with these key issues. So we're putting out monthly newsletters that just give you an overview of some of the key things that we're doing as a collective, and then any opportunities that we've seen. You can kind of join in and get free access to the webinars and seminars and catch-ups. Any sort of blogs that have been written or articles that have been sent in to us or shared, you can read them and get access to them through here. So you can see this little video is just scrolling through the first newsletter that we shared. And then there's some articles as well that have been written by Professor Andrew Weeks and others in the collaborative. There's the report from the 5 Times More that was published recently, links to conferences and events that you can attend, all included together so that we can try our best to support each other alongside the work that's been done across social media and beyond. So we managed to do our first seminar series, which was addressing the crisis in midwifery and maternity care, where we were able to sort of unpack things together. You can still watch this if you're interested. It's free. You can go on and use the Birth Collective code and go onto the hub and do a catch up if you're interested. But for just as a little overview, we heard from Professor Dr. Andrew Weeks, who's a professor in international maternal health, Dr. and Professor Sue Down, Professor in midwifery, Dr. Anna Horn, medical anthropologist and doula and birth activist, and Dr. Claire Feely, lecturer and researcher in midwifery maternal health. And they took a different perspective, thinking about the challenges and issues from different points of view and shared them. So Andrew talked about the perfect storm and all these confounding factors that are influencing and impacting on safe maternity care. Sue talked about some of the challenges with the midwifery workforce and morale across midwifery. Anna talked about the impact of birth justice on birthplace and restrictions over choice on bodily autonomy, and some of those issues affecting racism and discrimination. And Claire talked about how we can optimise physiology across all birth experiences in all birth settings. So, really good start. We had lots of panel discussions, so everybody that comes along to the seminars can get involved and chat and share their points of view, which is a really supportive way of feeling that you're part of the community. You can share and ask questions, and everyone's able to catch up with the learning afterwards and get a little certificate. And what we learned from the first seminar, with these are some of the themes coming across. We have had over 100 people join the first seminar, and these were some of the themes from the things that they were saying. So challenges around education and workforce, access to birth settings, restrictions to home births and midwifery-led units closing, challenges around recognising birth trauma and psychological safety, and people shared links to the recent birth trauma inquiry along with other resources of information and sources of information, the importance of the need for professional well-being and support. And there was lots of resources and research shared on the day. So the next seminar is going to be on the 23rd of October, hosted by King's College London with Dr. Claire Feely and Dr. Carol Kingdon, a sociologist working at Liverpool University. If you want to join in, you can. It's hosted, like I said, through King's College London, and it's going to be looking at evidence-based maternity care, looking back to move forwards. So feel free to join in. It's just always remembering that ours is a work of heart, and no matter where we support people to have their babies, whether it's in a hospital, home, or whether it's a cesarean section or a pool birth or whatever mode of delivery, we want to make sure that at the centre is always the family, their needs, their preferences, and their clinical requirements, and that we're offering safe, compassionate care.